This is a report that if you are a parent who has a child or a teenager who is attending CAMHS, your heart would sink. You would be considerably worried.
The crisis in our CAMHS services. The Mental Health Commission has identified serious risks to the safety and well-being of children accessing CAMHS, including 140 children with open cases who had been lost to follow-up. Ciara, just some of the other points on this that have come out. These are young people in need of an appointment but had not been contacted to report notice. They include children on medication, with some reaching their 18th birthday with no discharge or transition to adult services. In one team covering Kerry and Cork, a consultant psychiatrist covered 23 and a half hours a week by tele-psychiatry from the Middle East. And one last thing, there's lots in this report, but one other point, the one that really jumped out at me and a real failure here is a child waited 4 days in an emergency department until they could be assessed by a consultant psychiatrist. Now, 4 days for a child in a maternity hospital, an emergency department, is an eternity, and that's obviously a child, as you said earlier, badly in need of services.
There's only one
help.
reason you send a child to an emergency department in a mental health crisis is because they're self-harming or because you're concerned about things like suicide. Waiting 4 days at that point is dreadful. What jumped out at me is the system and the service has been described as inefficient and unsafe. And if that doesn't sum it up as pretty brutal, I don't know what does. I'd love to say I'm surprised. I'm not. I was 20 years as a doctor, and 2 of those years I spent working in psychiatry, not CAMHS. I worked in the adult psychiatry service. And I'm not surprised. And I think it is under-resourced, but I think we have legacy issues. I think our mental health patients have always been sort of the Cinderellas of the health service. I think there's an issue around all of that. But this is an awful thing to say, but I think about other areas of the health service where I sent patients and patients would come back and say, breast check, it was fabulous, or I went into hospital, I had my surgery, it was great. We do hear good stories. I'm not sure I ever heard a single good story, and that's the truth about CAMHS. It is a service that families felt let down by quite regularly, and that's an awful thing to say, and I don't like kicking aspects of the health service. I know there are many, many good people out there working, but there's something wrong here.